Okay, so it must be right at the noon hour. So welcome to today's Time to Act Mental Health Echo. Again, if you've not taken a minute to put your name and contact information into the chat, please do so. It helps us, everybody on the call, to know who we're talking to, who we can reach out when they share such amazing information, and a way to just build that professional networking that hopefully we all get on these calls. We are recording today's session. It is always available for you to go back and review, share out with colleagues or coworkers. And again, we hope that Echo is interactive. I know sometimes being virtually, it's easy to turn off your camera and do some multitasking, but ask your questions. Kurt Phillips is one of our hub members, and he will monitor our chat to make sure your questions are being asked. And so if you feel comfortable turning on your camera, coming off mute and asking your questions, or putting those in the chat. We do just ask that you maintain individual privacy. So sometimes the things that we share are of a sensitive nature. So just de-identify. If you have any questions about that, you are free to reach out to a hub member. They all have an asterisk in front of their name, or will rename their profile right now with an asterisk so that they're easier to find throughout today's session. If you've never been to an Echo session, welcome to Echo Mental Health. We will always have a didactic speaker that talks to us about a specific topic. And then we do my favorite part, which is a case presentation. And we all get to discuss and talk about this case presentation. And we get to hear all the amazing things that everybody on this call is doing. Learning new resources and information that happens. I love when I'm in a breakout group and I hear a resource and I'm like, oh my gosh, this isn't my case, but it's going to help with the family I'm going to go see tomorrow. So it's a great way to just learn those new resources that are out there. Renaming your profile. We've all been on Zoom forever now. And so hopefully we all know how to do that, but here is a direction, as well as to raise your hand. But again, you can just put your questions also into chat, and Kurt Phillips will monitor that for us. In order to get a credit of attendance, we do ask that you complete the survey. Throughout today's session and in our follow-up email, our survey link will be there. After we receive the survey link, it is when we send out certificates. And thank you to everybody who always completes those surveys. It helps our amazing hub team guide and direct these sessions, as well as take that information back to our funders so that we can share and show all the amazing things that are happening in these Echo networks. Canvas is where we store everything. So if you would like to have access to our Canvas page, just shoot us an email at timetoact@aggies.usu.edu, and we will get you set up for our Canvas page. We are always looking for case studies. Case studies are a great way, again, to hear from all the amazing people on this call and to discuss some of the clients and families that we work with. So if you are interested in submitting a case study, please reach out to us. I know that sometimes it can be nerve-wracking to share in front of everybody. So if you have a case and you would like me to talk about it, I will be glad to present that for you, or one of our hub members can also present it. We do have a Facebook group where we are hoping to continue some discussions after today's session and other sessions. It's again just that way to connect with other people that are doing the same work virtually. And again, social media, as well as just thank you for all your participation in our Echo. I am going to stop sharing and turn the time over to Diana, who is going to be our presenter today.
Thank you so much, Janelle. I really appreciate that introduction. My name is Diana. I'm one of the outreach coordinators for Safe UT, and we'll be learning a little bit more about Safe UT, as well as some of the resources throughout the state that are related to Safe UT and how we connect with the overall crisis service that is here in the state of Utah. So, like I mentioned, we're going to go over a little bit of an introduction of the community crisis intervention and support services that the state of Utah has, as well as a breakdown of some of our data when it comes to Safe UT and Safe UT Frontline. And lastly, I'll be talking over some of the outreach opportunities that Safe UT can provide throughout the state of Utah that are free and available to anyone that just would like to request that. Well, let me begin giving a quick breakdown on the service itself. Safe UT is part of the community crisis intervention and support services that the state of Utah has here. Under that same umbrella falls the Utah Warm Line, the Utah Crisis Line, and 988, as well as the Mobile Outreach Team, which is normally called MCOD, and lastly, Safe UT, and all of the apps that fall within the Safe UT umbrella. The Utah Warm Line is a peer service that the state has where individuals who are not in crisis can connect to another peer and get that emotional support that they need between the hours of 8 a.m. and 11 p.m. This line is available all 7 days a week and can be found by using the phone number, which I forgot to include on there, but I'm happy to include in the end of the presentation. The Utah Crisis Line, as well as 988, are crisis services that the state of Utah has, allowing individuals to be able to connect with crisis counselors here with the state and be able to get that emotional support when they are in a moment of crisis. This service is available 24 hours a day, 365 days of the year, and can be accessed by either calling the Utah Crisis Number line, which want to say I do not have that number on there either, but you could also use the 9883 number suicide prevention hotline, which will connect you to our crisis counselors here in the state of Utah to get that extra support. Lastly, for individuals who need a little bit further assistance and would like to get support in person, when contacting with the Utah Crisis Line or 988, as well as with Safe UT, if our clinical staff sees that individuals may need or may require that extra support in person, we can connect them to our MCOD teams, ensuring that someone can be there in real time at the location that the individual is at. Teams for the mobile crisis intervention teams tend to comply of a licensed clinician as well as a peer support specialist. That way we can provide both resources from the clinical point as well as the peer point, ensuring that the individual gets the best support at the lowest level of care. Lastly, the main one here, or the one that I'll be speaking about the most, Safe UT. Safe UT, as you guys may all know it, is an emotional support crisis app that is here and it was created for the state of Utah. When we first began this program, it was initially just for education. At this moment, I am proud to say that Safe UT does have 3 apps in total. Our education app, which was rolled out in 2016, and at this moment services 100% of education, as well as our Safe UT National Guard app in the dark green, which services all of our National Guards members here in the state of Utah and their family members as well. And lastly, as of 2020, with the COVID-19 pandemic, Safe UT came out with the Safe UT Frontline app. This is the app in the dark blue. This app is specifically for individuals of the frontline community and all of their family members. And today we'll be learning a little bit more about our education app as well as our frontline app for everyone here on the call. So let me begin with the breakdown of SafeUT, our education app, when it comes to our data and kind of some of the things that we normally do with schools. And let me begin by providing this quick video.
When we ask for help, it can have a lot of meanings.
Especially when it comes to our emotions.
SafeUT is a no-cost, confidential app that connects you with a licensed counselor
Who's there to help you through any sized struggle you may be going through.
Sometimes it's a temporary obstacle, and you just need someone to talk you to the other side.
Other times, it's not so temporary.
A counselor is someone who can be there for you.
Listening and providing cover.
And sometimes, life can get so overwhelming.
You feel like you're fighting to survive.
That's when a counselor can be a lifeline.
You can call, you can text. It can be for you.
Or you can use the anonymous tip line for someone you're worried might hurt themselves or others.
SafeUT is here for you. Whether it's something big, something small.
Or something where you're not even sure what it is.
Don't ignore it.
Try talking to someone. It's always better to be safe.
Many of the attendees on this call may have heard or know a lot about the SafeUT app. What you may not know is that at this moment, SafeUT has given total access to more than 1.9 million Utahns who are currently able to connect to our licensed mental health professionals completely free and confidentially 24 hours a day, 365 days of the year to get support either if they are adults for themselves or for their kiddos. And for any of our youth that are connected to education, they have the ability to connect with an individual that will be able to provide the emotional support that they need in cases where they feel stressed, overwhelmed, or are dealing with emotions that they're having a hard time de-escalating themselves. Our counselors are going to start by verifying the safety of the child and what situation they're dealing with. From there, we will go in and try to verify what are the regular coping mechanisms that the child uses to ensure that they can de-escalate and they can start working with the coping mechanisms that they already have. If for whatever reason these coping mechanisms are not working, our clinical staff will try to give some advice and provide options that the student could use to get that extra support. Now, for adults, many parents, especially in the last few years, I don't know about you guys, but my 11-year-old stepdaughter sometimes has situations where I don't know how to approach those conversations. One thing that SafeUT does is for any parent that needs support on how to begin a conversation with parents or how to approach a subject with your child, please don't hesitate to reach out. This is a way where you can connect to someone that can help and can advise you on the best ways to talk to your child or talk to other family members who may be dealing with high levels of stress, anxiety, depression, and any other mental health condition that could be affecting their lives. Now, SafeUT at this moment has enrolled 100% of publicly funded education. This does include K through 12 as well as higher education. When you see, as you see on this screen, for our K through 12 breakdown, we have 99% of high schools as well as middle schools who are enrolled in our program, and 97% of elementaries. And lastly, we have 93% of charter schools that are also enrolled in this program, ensuring that students, parents, and educators who are the main demographic for this app get the support that they need at the lowest level of care, ensuring that it doesn't matter what time it is, they know that there's going to be someone on the other side of the phone that will be able to help them through that specific situation. Now, for higher education, we have also enrolled all publicly funded institutions, as well as a few other private institutions, ensuring that all of these students in universities and colleges throughout the state have that extra support as well. including overnight, especially when we see individuals who are dealing with stress and anxiety around midterms and finals. This is a great resource that can be promoted to higher education students to get them that extra support after hours when other universities or colleges may not be able to provide that support. Now, let me share a little bit more about how our SafeUT app functions through the help of my 2 or 3 friends here on the screen.
Hi, I'm Sadness.
Fear.
Loneliness.
We're things everyone feels. And that's okay.
But you do not have to feel us alone.
With SafeUT, you can talk to real licensed counselors about whatever is troubling you, whenever it's troubling you, at no cost.
SafeUT can help you meet many of the challenges you're facing. Whether you're struggling with depression, not feeling good enough,
Need someone to talk to?
Worried about your own safety, or concerned about a friend. Parents and guardians can use the app to understand how to better talk with kids, teens, and college students in their life.
To start a chat, tap here. Type your concern, thoughts, or questions, and hit send.
you'll be connected to licensed counselors at the Huntsman Mental Health Institute who care for and want to support you. Available 24/7.
You can also submit a confidential tip.
To submit a tip, just tap here. Tell us your concern. Review your tip summary and hit submit. You can even include photos. Anyone who works at school, attends school, or cares for someone at school can send tips.
All tips are immediately reviewed by crisis counselors. Non-urgent tips are sent daily to appropriate school administrators, while counselors use their best judgment on involving law enforcement for the more serious tips.
If you're struggling and need to hear a real voice, tap to start a call. You'll talk to certified crisis workers who staff the Utah Crisis Line.
Whatever you say in chats, tips, or calls is confidential. Licensed counselors are trusted adults and only share relevant information when you or someone you know is at risk of harm. We'll always encourage you to make connections with other people in your life who you can trust. The app offers password protection on your old chats and tips, which you can see by hitting this button here.
SafeUT is here to listen, support, and hopefully introduce you to a few of our friends. Hope.
Safety.
And confidence. So, however you're feeling, there's a way to talk about it. Download SafeUT today.
Download the app today. Learn more at safeut.org.
The SafeUT app is completely unique to the state of Utah, and like other crisis services that are connected with education throughout the United States, SafeUT is the only service that provides crisis response intervention as well as an aspect of school safety, ensuring that it creates a wraparound service, allowing students, parents, and educators to get that emotional support as they need, if they need it, as well as ensuring that if students, parents, or educators see, overhear, or find out of any potential school threats or situations of bullying or anything that could cause harm to another child, they can report it through the SafeUT app, ensuring that all of our kids are both emotionally and physically safe while they're in school and while they're away from school. The SafeUT app has 4 main functions. When individuals first log into the app, they are asked to select one of the following categories. They can either be a student of K through 12, a student of higher education, a parent or guardian, or lastly, an educator. After selecting one of those options, the app will make it so that individuals have to select what school they are connected to. After they do this, they will be able to see an example of what you see of the app, which is on the screen. The 4 main functions of the app include our Start a Chat. This function allows individuals to be able to connect with our licensed mental health professionals, ensuring that if they're dealing with a stressful situation, if they're having a hard time at school, or if they're dealing with anxiety or a panic attack, they can get that extra support with the help of our licensed counselors through the chat function. Now, for any individual who would like to provide any confidential information to a school regarding school safety or helping ensure that kids stay safe, as well as promoting any acts of kindness that they may see throughout the schools, they can do this through our submit a tip function. This function asks us several questions for the individual, making it a little bit easier for our counselors to be able to review the information and then connect with the user to try to make sure that we can get as much information as we can, which then will be then submitted to school administrators and school points of contact to ensure that we can provide that extra support, not just through the help of Safe UT, but with the help of resources at the school level. In some situations, when we do have cases of suicidal ideation, we can connect with school administrators to ensure that we can get either MCOT or law enforcement to be able to do a welfare check and ensure the safety of the child or individual on the other side of the phone. Now, one thing I also want to emphasize on this is Safe UT, when it comes to the tip function, is mostly a messenger. We acquire the information from the users, and then, as I mentioned earlier, when you first log in, you assign which school this information is going to go to. If you need it, that is something that can be done for all schools throughout the state of Utah, just in case you are aware of a situation where a child may need extra support and it may not be pertinent for you to specifically be part of the situation. Providing confidential tip information allows individuals to kind of stay slightly away, but ensure that any child or educator get the support that they need at the lowest level of care, with the help of the school district as well. Now, for any individual who uses the app to get any emotional support, they can always go in and review any chats or tips that they have submitted through the app by viewing the bottom corner, which is the view existing. This will let you review any of the communication that you may have had with any of our counselors in the past. Now, I will say this function specifically is password protected, which is something that you first create when you download the app. This password is something that is very important for you to remember, because if individuals do forget the password and we have to reset it, any information that was saved under that password will be immediately erased as well. So make sure that if you are promoting the Safe UT app to families or to students, to let them know to create a password that is something that they will always remember, so that they have the ability to go back and use this information that our clinical staff has provided as a way to help reinforce those coping mechanisms to ensure that the individual does not end up in a crisis situation again. Now, if any of you guys are like me, I'm not much of a texter. So Safe UT has also included a call function. This function will connect individuals to the Utah Crisis Line and to the crisis counselors at the Utah Crisis Line who work alongside with us to ensure that they get the support that they need at the lowest level of care. And more importantly, for anyone that feels more comfortable talking about the situation over texting, they have the ability to get that whenever they need it, 24 hours a day. Now, in the last fiscal year, Safe UT received 26,808 chats to our service. And additionally, we also received 8,985 tips that came in to our service from all around the state. Now, when we break down those tips into different categories, we see that for the first time ever in Safe UT history, suicide is not the first or the top category that we've seen students provide tips for schools. For the last year, we've seen an increase in bullying all throughout the state. And this is bullying that's happening both between children, between siblings, and more importantly, between children and adults as well. Students have the ability to submit confidential information about bullying situations to ensure that students at the school stay safe, not just physically, but emotionally as well. As you see on the screen, in the last fiscal year, Safe UT received 26% of tips that came in were regarding bullying, 22% or 23% regarding suicide, 10% regarding substance use, 9% regarding school complaints, 9% regarding potential school threats, and I'll come back to that specific category in just a minute. We also saw mental health coming in at 6%, abuse coming in at 5%, self-harm coming in at 5% as well, interpersonal issues coming in at 4%, and stress coming in at 3%. Now, let me go back slightly and kind of touch on the potential school threats. In the last, want to call it almost 2 years, 18 months, give or take, the state of Utah has seen an increase in potential school threats. And unfortunately, this is not just a trend that we're seeing here in the state, but nationwide. Safe UT has given the ability for our state to be able to get that information in a confidential way so that we can ensure that our students stay physically safe while they are in school. In the last fiscal year, our school threats broke into three different categories: violence at 60%, weapons at 20%, and just overall school threats at 20%. I don't know about you, but this is an alarming number. The one thing that I am happy to say is our students and parents throughout the state see this resource as a way to ensure the safety of their children. Excuse me. Oh, sorry about that. This service allows individuals to be able to confidentially submit any type of information to not just school districts, schools themselves, but also Safe UT. When we do get any potential school threats, Safe UT will first connect with school districts, the school themselves, and in situations depending on the severity of the threat, we also will connect with local law enforcement to ensure the safety of all students in that location. If the threats do happen to come in after hours, we can also ensure that administrators at the school level and at the district level are aware of the situations ASAP.
Diana,
Now, yes.
can I just break in real quick? There's a question from Greg in the chat that kind of ties into this availability to administrators and training. It says, is the Safe UT training available to school administrators and counselors? What advertising is made within public school spaces? And then further down the chat, he also asks about impact of recent Utah laws on student access to phones while on school property. So if you want to answer that now, if not, we can come back to that if there's a section coming up that'll address that.
No, those are great questions. So let me start with the first one. Does schools provide all of our information? Yes. So every single school in the state of Utah receives training, not just for designated contacts, which are our main points of contact, but we are also actively working with school districts to provide trainings for all levels of education, ensuring that district staff members, all educators, and members of the community that work within the school district are aware of the services that Safe UT provides. This is something that we are working really hard to ensure that everyone that is connected to education is aware of. Now, yearly, Safe UT will also provide marketing material to all of our schools, ensuring that our promotional material is available for students, educators, as well as parents. I will tell you that the main thing that we've seen issues with is the fact that many parents are not aware that this service is also available for them. Many people, when they hear Safe UT, say, oh, this is a suicide prevention service only, and this is only a service that is available for students of K through 12. That is something that did happen at the very beginning when our service first started, but at this moment, we service individuals starting in kindergarten all the way up to post-level education. and all of their family members as long as they lived here in the state of Utah. Now, with that, it's kind of hard to say how to approach this with other individuals, but that is something that we are currently working with, ensuring that we can provide this information to as many people as we can. And the trainings, which we can do for anyone out in the community, just so that they know a little bit more. Now, one of those questions was also regarding some of the changes in legislation. We are currently working with school districts to ensure that with the change of legislation, especially with cell phones now being banned from schools, we are working with school districts to ensure that the web version of our app is also downloaded in every Chromebook and laptop and tablet that school districts have, to ensure that students have the ability to connect with a counselor through SafeUT whenever they need it, as long as they have their laptop, tablet, or Chromebook with them. With that as well, we are doing some extra changes with SafeUT. If you are interested in learning more about those changes, please reach out to me afterwards. I'm happy to provide my information and make sure that I can answer more questions that are specifically dealing with the legislation. At this moment, I know that our admin team as well as our IT team are working on some extra changes on the app, and we're not ready to discuss those yet, but if you do have any questions, please reach out to me. I'm happy to answer them as soon as I have more information that I can actively give you at the moment. Are there any other questions before I keep going?
Just one comment in the chat as well, Diane. It just says, I'm a parent with children in the public schools and I had no idea about this. Their school hasn't said a word to us about this. I'm kind of frustrated that they didn't say anything to the parents. So more just a comment than a question.
And I completely empathize with that statement. This is actually something that we hear a lot from parents, especially when we're out in schools and in communities. School districts and schools try their best to provide as much information about all of the services that the students have available to them, as well as the families. Unfortunately, one thing that we have noticed is a lot of this information tends to be provided to parents at the very, very beginning of the school. And with this, they tend to get this huge packet full of information. And if you're anything like me, I get home with those packets, I put them on my counter, and I step away. And maybe sometimes I'll go through some of the information, but not always do we go through all of it. A lot of our information is given throughout that very beginning packet, and many schools have tried to provide as much information to parents. For anyone that is working specifically with schools or working more closely with education, if you would like to reach out to us, we do parent presentations as well as a variety of outreaches that we'll talk about towards the end of the presentation today, just so that our community members are aware of these services and can actively use them in a way that it works for them. With that, any other questions? No? Okay, I'll keep going. So as we are kind of talking about our education app, I also want to slightly step aside and give more information about some of our other services. This is where our SafeUT Frontline app comes in. In 2019, when we started to see that SafeUT was a resource that could be used to help more than just our students, parents, and educators, we came out with our National Guard app. This app specifically for our National Guard members here in the state of Utah and for all of our family members. Now, since then, we had the COVID-19 pandemic in 2020, which caused a lot of stress for frontline workers and their family members. And that is when the state of Utah decided that we needed to roll out an app that was specifically for members of frontline communities. Now, with this, you may ask, who falls under this umbrella? And to answer that question, let me
We know that people don't come see us because they want to.
We don't get called to someone's house saying, hey, I'm having a great day, come visit with me.
People are calling us on their worst day for us to come perform our best.
it's tiring. It takes all of your emotional reserves.
And you carry that with you. So you need to know how to deal with those emotions and that stress.
The Safe UT Frontline app is geared specifically to frontline professionals.
Use the resources that we have. Please reach out.
The Safe UT Frontline app is available for anyone that falls under the following umbrellas: law enforcement, healthcare workers, firefighters, EMS, corrections, and 911 dispatch, and other members of the health and human service community. Now, for this app, individuals can go onto their app store and find the Safe UT logo with the dark blue color. This is our Frontline app specifically for members of those communities. Now, I've worked within the Frontline community for the past 5 years, and some of the things that I have personally seen and some of my colleagues have shared are quotes that are here on this screen. For many of us and many members of the Frontline community, sometimes it can be really hard to deal with the day-to-day situations that they experience. And cases or quotes like this is something that we hear quite often. I'm going to share the one that I seem to hear the most often, which is, I get home at the end of the day and I'm exhausted. I'm so tired that I don't want to deal with anything at home, but I can't shut off my family. This is a quote that I actually hear a lot from frontline workers all throughout the state. Individuals who have spent their lives taking care, helping, and doing as much as they can for other members of their community, ensuring that everyone else is both physically, emotionally, and in all well-being, well, safe. But unfortunately, in the last few years, there's been so many things that have happened that many frontline workers haven't had a chance to say, how can I take care of myself? What can I do when I'm feeling overly stressed, when I'm feeling burnt out, when I just can't do this anymore? And that is why Safe UT Frontline was created. At this moment, Safe UT Frontline provides services to over 155,000 frontline workers throughout the state of Utah. This means that every single person on this call has access to the Safe UT Frontline app, ensuring that you and your family members have that extra emotional support that you may need while you're dealing with stressful situations at work, in your personal life, or with anything that may be happening to you or your family. In the last fiscal year, Safe UT Frontline received over 13,000 chats that came into this app. Unlike our education app, Safe UT Frontline has no tip function. What it does have, it has a specific button that allows your family members to connect directly with our clinicians to get that extra support and to make sure that if they are seeing any coping behaviors or anything that could be a sign that you may be dealing with high levels of stress, you may be feeling burnt out, or you may be dealing with an emotional situation that is very distressful, this is how your family members can get advice on how to bring this conversation up to you or how to help you without overstepping. For yourselves or your family members, the Safe UT Frontline app gives you that extra connection without having to worry about how could this affect me. Like our education app, this app is also completely confidential, ensuring that when you first log into the app, we're never going to ask you personal information like your name, phone number, or even more importantly, what agency you work with. All we want to know is which one of those categories do you fall under. So in the last fiscal year, Safe UT saw the following utilization of this app. We had the biggest category being healthcare at 48%, followed by law enforcement at a 33% utilization. then followed by correction officers at 10, and firefighters and EMS at 9%. One thing to note is if you would like your own personal button or feel like there is a specific member of the frontline community that is not discussed in this, we have been able to add more individuals into this program. 2 years ago, this app was only available for healthcare workers, law enforcement, and firefighters and EMS. Last fiscal year, we were able to provide support to all of our correction officers here in the state of Utah. And as of this year, I'm happy to announce that we are now also expanded this to 911 dispatchers and other members of the Health and Human Services umbrella. For other individuals that need that support, please don't hesitate to reach out. This is a service that is available and can provide support. Now, I'm also going to share a little bit more information about how this resource works with the help of some of our awesome people that helped create this app and gave us some ideas on how to approach this app with our frontline community. With that, let me share this last video.
Hi, I'm Sam Winkler. I'm a retired police officer.
My name is Dr. Crystal Armstrong, and I work for the University of Utah Health.
I'm Jack Tidrow, president of the Professional Firefighters of Utah and an active duty Salt Lake City firefighter.
We're here to talk to you about Safe UT Frontline.
We know you're busy, so let's get started.
It's an app that helps to connect frontline workers with someone specially trained to help us deal with some of the difficulties we face every day. So the beauty of the Safe UT app is you just pick up your phone, click on the app, and then you can choose whether to call directly or send a text. This goes to a master's level counselor who can help speak directly to you or respond within minutes to the feelings and emotions and stressors that you are dealing with. You just click on the button and it goes directly to the person you're looking for, and they'll stay on the line with you until you feel safe.
The Safe UT Frontline app is for firefighters, EMS workers,
law enforcement,
doctors, nurses, but also can be used for our families.
There's no cost to use this. It's a free app to download. It's free to use. You don't have to enter credit card information. There's nothing.
There's no limit to how much a member or their family, their dependents can use the app.
There's no insurance. You don't need appointments. This isn't going to go through anything. No one else is going to see it. This is not reported anywhere. It is just completely confidential, completely free between you and the person you reach out to.
No matter how tough you are, you still need to talk about it.
It's not going to shock them. It's not going to be something they haven't heard before. They are trained to deal with this. They're there for us.
Just as you can't predict an emergency situation, you can't predict when you yourself or your loved one needs help.
When you work in law enforcement, healthcare, or emergency services, it's your job to help people. But sometimes it's your turn to get support, and that's okay.
So download the app today, so when the moment comes, Safe UT Frontline can have your back.
One more thing I would like to emphasize before I keep going is you don't have to be a clinician under the healthcare umbrella to be able to access this app. Individuals, as long as they work within the umbrella of healthcare, law enforcement, firefighters, EMS, corrections, and other services provided by Health and Human Services, they all have the ability to connect as long as you fall within the umbrella, whether it is an admin, whether you are a secretary, it doesn't matter how you're connected to those areas. As long as you are connected, you have the ability to get the support that you need through the Safe UT app. Now,
Anna,
yes.
a couple more questions in the chat. Probably easiest if you just read them rather than me reading all the way through. But there's one from Nishta, and one from Megan, and one from Janelle in the chat. Janelle asked about educators reaching out the front line. Nishta asked about people from Indians reaching out. And Megan asked about how they can connect with the organization. So those are all three in the chat there.
Perfect. Let me pull those up right now.
Can you see them, Diana, or I can read them out?
I cannot. I'm so sorry. I gotta find
The
them.
first one says, how can educators reach out to the Frontline app? Can they use that?
No, they cannot. Unless their spouse or family member is connected to Frontline services, we want our educators to specifically use our education app. Now, with the education app, I will say for our educators, the chat function, that is between SafeUT and the individual using the service. The tip function is the one that is submitted to school administrators and to the schools and school districts so that we can provide that school safety aspect and extra support at the school level. For any educators that would like that emotional support, no matter what time it is, they can still use the app. Just make sure that they are signed in as educators. This will help all of our clinicians identify how to best support them at that moment.
Okay. And then the other one is, how can Indians connect with the app?
Fantastic question. So SafeUT at this moment can provide services in a variety of languages. For our text function, the majority is going to be English and a little bit of Spanish. Unfortunately, at this moment, we don't have any other languages that where we have clinicians that can text back in anything apart from Spanish. But for any individual that speaks Hindi or that speak any other languages throughout the world, please let them know that as long as you're living here in the state of Utah, they can still access our services by using the call function on the app. This function will connect individuals to our counterparts with 988 and the Utah Crisis Line, where they are able to get support in, I want to say it's over 175 languages, including Farsi, Russian, Ukrainian, Spanish, and French, German, so on and so forth. Those are just the ones that are off the top of my head. That is going to be the easiest way for individuals who speak multiple languages or who speak a different language to be able to get the support that they need.
And then the last one is, how can we connect and possibly help with this amazing organization? And who do we contact for more information about working with Safe Utah?
Fantastic question. So one thing to note is all of our staff members here at Safe UT are all, none of them are volunteers. They all work under the Huntsman Mental Health umbrella. We all function as part of crisis services, which means that if you are interested in joining our team and would like to see if there are opportunities for you, please go on to the University of Utah employment website and you can search Safe UT clinicians or crisis services under the employment section. For anyone that would like more information, I'm happy to provide my info as well here and make sure that you can connect to me and I can send you to the right locations for anyone who is interested.
Okay. And then the last is a comment, and it just says, thank you so much for this presentation. This has been the most informative presentation about the app that I have seen. Good job.
Thank you. Now, let me finish this up real quickly with any support that Safe UT Outreach can have for any of you guys. If you would like more information about this, or if you would like your staff to get more information about these services. Safe UT under our program provides a variety of outreach opportunities. If your organization, team, or your group would like Safe UT to come out and do presentations, we do assembly style presentations for all schools, but we also provide parent presentations if you do any community nights. We also have trainings for staff members at all levels so that if you work in a clinic or in a hospital or in a setting where you would think Safe UT would be appropriate to be a resource that can be shared with the public, please reach out to us. You can request all of these presentations through the Safe UT website. Under the tab that says More, you will find a banner that says Outreach and Marketing, and that is where you can request Safe UT to come out anywhere in the state of Utah. Lastly, if your organization has any events where you think it would be appropriate for Safe UT to be there, please let us know. We're always looking to partner with other organizations. And more importantly, we're always looking to ensure that we can provide this information to all members of our communities. If you are interested and would like to have us come out to any events that your organization has, please let us know. You can always request that through the website as well. With that, I want to say thank you guys so much for giving me the opportunity to come out and talk to you guys. Hopefully after this presentation, you have a better understanding of how Safe UT and Safe UT Frontline works. And don't forget, as a frontline worker, guys, every single one of you does so much for our communities. Now, let us give you a little extra support. If you ever need someone to talk to or need that extra oomph at the end of the day because it's been a tough day, don't forget, Safe UT counselors are going to be on the other side of the Safe UT Frontline app to make sure that you get the support that you need, because we understand how much you guys do for our communities. Thank you guys so much. If anyone has any questions, I'm happy to answer them.
So if anybody has any questions, you can once again put it in chat or raise your hand and I'll give you a call on it. They are asking what is your contact information. That is in her presentation, wasn't it, Diana?
It is. I'm also including it in the chat right now.
Okay. Here is a link to the PowerPoint. And then it says, is 988 the number to call for the crisis helpline?
Yes, it is. It is one of the numbers that you can use to call for the crisis hotline. It is going to be the easiest way to get a hold of one of our counselors. So I just put in the chat both my work personal email and the Safe UT email overall. You can reach out to either one. If you have more specific questions about today's presentation or about some of the legislative changes, please don't hesitate to reach out at the Diana Ballesteros at utah.edu. If you have more questions regarding outreach or how we can provide that extra support for your community, please make sure to email us at safeut@hsc.utah.edu. Yes, Heather.
Diana, thank you so much for coming. We appreciate it. I love how much that you shared, and as we discussed it when we talked about setting this up, there is so much about these apps that we just don't know. And one of the questions that I had is that kind of got brought up earlier is the difference between the education app and the frontline workers app. And then you do have the National Guard app. And one of the things that I wanted to ask about is, so with those who are working, like say in social work or in therapy, you know, counselors, therapists, those kinds of things, we have kind of those crossovers where we have counselors in the education setting in schools, and we have those who are working in private therapy, and then social workers who are in the schools and those who are not. And then we have early intervention who sometimes they're tied to the school districts and sometimes they're not. With the difference between the two apps, can you kind of give a little bit of guidance about which is more appropriate as far as those who are maybe seeking to use those apps when they need that support, and where's the more appropriate direction for them to go in that area?
Absolutely, Heather, and that is a great question. This is actually something that we hear quite a bit from members all throughout the state, because you're right. Within education, you will find social workers, school counselors, psychologists, as well as nurses. So for this reason, the individuals that fall within the frontline community who also work at a school or are connected to education have the ability to use either one or both, depending on the situation. So in the case that, let's say, a social worker may overhear a child uh, tell their friends that they are being bullied. Of course, the social worker, if they are in the school setting, will take care of it within the school settings. But if it's a private counselor, they can actually use the app as to provide that confidential information depending on HIPAA and how much they're willing to provide. One thing with that is for any individual who's dealing with personal situations that would like to use the service, we would recommend the Frontline app. This app is going to be completely separate from our education app, and our counselors know not to overlap. Now, for any situation that is dealing with a student or education, that is where we would say, please use the Safe UT education app, because that will be able to connect individuals and that information to the appropriate individuals at the school or district level. I hope that kind of answers a little bit of your question. Does anyone else have any other questions?
Thank you so much, Diana.
Of course, thank you guys. If anyone would like Safe UT to come out, or if you would like to learn more about some of the changes that we are having with our legislation, please don't hesitate to reach out. Happy to answer any questions that I can. And just to let everyone else know, if you're interested to know, please reach out to us. We will be doing a lot of these implementations and changes around July, which is when the fiscal year will begin again. So please let us know if you have any questions, and if you have any concerns or suggestions, please reach out to us. We're always looking to make sure that this service is user-friendly and available to all of the members in our communities that have this. So thank you guys.
Thank you so much. Okay, I'm going to turn the time over to Kurt Phillips. He is doing our case presentation today. Kurt, you're on. There you are.
Yeah, I'm good. Thank you, Janelle. Let me just share my screen quick. Tell me if you're seeing the right screen there. Does that look right?
Yes.
Perfect. So my name is Kurt Phillips. I am one of the members of the ECHO group up here at the Institute for Disability Research, Policy, and Practice. Also a physical therapist for about 25 years in the Part C early intervention programs. Just wanted to share a case with you today that highlights some of the struggles that I've maybe run into over the time in a specific case. So that first one just talks about me and what my experience is. I get that real view as I'm in homes with people. The specific one is about a mom who's currently single and is taking care of her children without regular support from her ex-husband. She's had to take a full-time job on because of a recent separation with a partner. She has 3 teenage daughters from that initial relationship, and has a 2-year-old son from her most current relationship, which is over now. In the past several months, or a year, she's noticed that her daughter's been spending a lot more time on social media. It's been associated with a decrease in her interactions with her, between her and her kids, and has also led her to be concerned about they've been more reclusive and less communicative with her. She's in the past relied on her daughters to help take care of the 2-year-old son when she's working. She works mostly nights. So the daughters, usually they put the kid to bed and then the daughters are just there to make sure everything's okay. But due to the increased social media usage and being on their phones and tablets and that a lot, she's worried about their ability to pay attention to their stepbrother, and that leaves her being worried and less confident in leaving him with them. She's also noticed her daughters have been hanging out with some boys she doesn't approve of, and is worried about what happens if, while she's at work, the daughters invite these guys over, and is her son going to be safe? Are they going to be too distracted? So the main areas of concern that she has, first for her son, he's just got some mild delays in several areas of development, which is where Part C becomes involved. But she's worried if he's being watched appropriately by her daughters. Is he safe if the other boys come over while she's at work? And are her daughters being distracted with their phones and social media while she's gone and they're supposed to be watching? She has concerns for her daughters as well. She's worried about the excessive use of social media, has heard about ties to anxiety, depression, low self-esteem. Also worries about their increasingly reclusive behavior, wants to have more interactions with them, and finally worried about their choice of clothing and the boys that they're hanging out with. She's worried about them being exposed to risky behaviors. And then for herself, she's worried because she finds herself being more stressed because of the situation. And so she's less likely to be able to respond to that stress in a positive way, she feels. Also worried that she's losing control of her daughters and that they're going off the rails. I guess that's a term, going off the rails. She also is feeling isolated. She's either always taking care of her kids, her daughters, her son, running her daughter's places, doesn't have any time to any social life for herself. And her group of friends is shrinking partially because now she's single and many of them are in relationships. And also she just doesn't have the time to invest in maintaining those relationships. So this is a situation. She's got concerns about her son, about her daughters, and with her own health. The goals, she wants to know how to navigate babysitting issues. She also wants to have solutions on how to steer her daughters in the right way, and also looking for ways to find time for herself to be with her friends. Barriers, it's said in the initial slide, her ex-husband is inconsistent at best with any kind of financial support. So their finances are really tight, time is really tight, and the stress is really high. And I know this is probably something we either know somebody or maybe we're in this type of situation with those barriers and those concerns and goals. So as a part of the case study today, when we go into groups, here's some things that she would love some help with. What's available to help with taking care of her son while she's working, since she isn't trusting her daughters to do as she used to. What about parents, help for parents of children who may be experiencing anxiety or depression or may be at risk for that? How does she encourage them to have less social media use and increase the interpersonal interactions within each other as well as with her? And then what resources are out there for her with the doubts about her ability as a parent, feeling like a failure, being overstressed with work and home, and helping the girls with getting their schoolwork done. So there's the case, Janelle.
Great.
Imagine we've got great solutions out there. We just want to find out what they are.
I don't know who in your group took notes or wants to share out.
Okay, so we had really good ones, but the one I'm going to mention is one that Melanie said at the very end, and I'm going to check it out myself, but it's the Child Mind Institute, and it's a journaling app for teenagers to help them, express their feelings. So that was one. And then a couple that I know is in Utah County, and then Heather said it's in Davis County, is the Strengthening Families classes that are offered by some universities, where the families will get together, they eat a meal, and then they break off, and they have the teens and the parents, and then they get back together and they actually practice the skill. And I think, I want to say like it's a 10-week program, but it's all free too. And I know that in Utah County, it is in Spanish too. So those were a couple. And then just some respite centers so the mom can have some time just with the teenage girls while the 2-year-old is not a part of that relationship for just a minute.
Awesome. See, that's my favorite part about the breakout groups, is because all of us have amazing ideas, but we don't always know and how to share those. So I think it's really cool to learn about those new resources. And then just a reminder about our session next month, which is from Emma Parkhurst from the USU Extension, is going to be talking to us about surviving burnout in the workplace. And USU Extension is who also supports the Strengthening Families classes. So USU Extension has some great resources too. So hopefully we'll see you all next month and enjoy the rest of your day. Thank you.
Thanks so much. Be well.